So the next session is the international aspects of cholangiocarcinoma. And yes, while the bell rings, I will already ask the next presenter to come on the stage. That's Professor Watcharin Liolme from Thailand, and she will give us a presentation on combating cholangiocarcinoma in Laos. Please.
Okay, thank you so much. First of all, I would like to thank Thailand and AMF for having us here. So today, what we are going to share is about work that we have done in Laos as a part of cholangiocarcinoma combating journey. First of all, I would like to mention this great man, our ex-leader and also the old friends of AMF, the one who's always dedicated entire of his life on combating cholangiocarcinoma and the liver flukes. So my talk will cover 3 parts, a little bit introduction to the problem and also recap a little bit work that we have done in Thailand and also what would be the next step. And the last session would be the work that we have done in Lao PDR. So as mentioned with many people, that we come from the capital city of cholangiocarcinoma because we have the highest incidence in the world that have been recognized. And also we have approximately 20,000 new cases diagnosed each year based on the documents of the National Health Security Office. And unlike in UK, our cholangiocarcinoma could identify the major risk factor, which is the liver fluke named Opisthochis viverrini. The PI, and you can see this one, so the upper panels, the hepatectomy specimens that, you can see the above things, the bile ducts that you can see a little, creature living on that, which is the liver flukes, is caused chronic inflammation for a long time, and then the tumor would happen. And people in my area would acquire the infections by eating raw or undercooked, menus that made from the scaly freshwater fish, which belong to the Siphinoid species. And actually, we have quite long journey on combating cholangiocarcinoma, starting since 1915, when the first reports of Opisthochis viverrini has discovered. And then in 1994, the WHO classified the OV as a group 1 carcinogens. And for the first periods of work, we mostly doing research. We try to find, the facts, the basic knowledge about the flukes and also how it causes cancer. So it takes about 20 years. And about 12 years ago, 1914, our ex-leader, Professor Narongkantikeo, had started cholangiocarcinoma screening and care program, or CASCAP in short, which is first sponsored by the Health System Research Institute. And then over 12 years, with his leadings, I think things is getting better and better. And then until now, we are about to starting the next chapter of work. And we hope that at least 10 years, the next future, we can see things a lot better regarding to this issue. And this is our operating structure. Basically, as a director of cholangiocarcinoma research institute, we mainly do research, including the basic, the clinical research, the translational research, and also we are now about to start again the implementation research. And we have cholangiocarcinoma Center of Excellence, which led by Dr. Attapon, the surgeon, which mainly cover the treatments of the patient and also training the team that taking care of patients. And we also have the hub of knowledge of cholangiocarcinoma, with taking care of the training also and also the technology transfer in order to solve the problem. And our work, not only us alone, we have a lot of organizations, collaborators, in both national and also international collaborations. And we develop also the tool that can use to solve the problem. We have the big database called ISAN cohort with register all the risk group and also the patients. So up to now, we have more than 3 million people registered in the system. We also developed the teleradiology consult system with the AI-8 diagnosis to help for screening by using the ultrasound. And also we developed the test kit, the urine test kit called the OV-ATK, which could easily detect the OV infections within like 5-10 minutes. And also we developed the school curriculum because we always know that the liver fruit in Thailand cause cancer. So in the wheel of health system, prevention is important than treatment. So we also developed the curriculum in order to prevent the disease in especially the young people. And one problem, there are many solutions, multi-phase approach, starting from the prevention, screening, diagnosis, and also treatment. And this is some of the picture representative, the activity that we have done as mentioned. So we have prevention program, we have screening program, and also we have treatment program. Until now, based on the CASCAP program, as I mentioned, we register more than 3 million people in the system. We do screen over 1.1 million of the OV, and we treated them. So we scan our screening for the risk group for the cancer up to 800,000, and then we took more than 35,000 patients to be, treatment. However, millions of the people, we spend over 12 years until we screen like millions of people. But back to my areas, more than 10 million of risk people are still waiting for the screening and treatment. So I will say that the coverage less than 10%. So this is the challenge, because in terms of infectious disease, you might need to bring up the coverage to be like 70%, and otherwise you would not can solve problem. So the next challenge for us is how to bring things that we done in research to be implemented in the routine works and increase the coverage. So in this case, we would have ability to solve the problem. So lucky enough, so I would like to mention here, from now on, we're gonna do the key strategic goal and motto Thailand to be free from the liver fruit infection and also prevent death from cholangiocarcinoma. And we are really lucky to have, health system research institute again, because they are the one who started the program. And then we have today Dr. Supakit with us here in the floor. So he will lead us and support us to bring the work in research to be implemented in the nationwide level. So the goal is quite challenge. Within 2 years, we hope to bring down the number of OV infection to be less than 10%, and we try to find more early cases using the ultrasound screening, which in turn would increase the longer survival of the patients. So this is what is done in Thailand, and the next one would be what we have done in Lao PDR. So this project called Combating Cholangiocarcinoma in Lao PDR, which is sponsored by the Kaduri Foundation in Hong Kong, with the great support from Imperial College London through Professor Simon Taylor Robinson and also Professor Richard Sim. So the project started since September 2018, and you can see Helen also in this MOU ceremony event. So why Lao PDR? Basically, the OV or Opisthoki viverni, this is not the parasite that belong to only Thailand, because actually there are 3 species together. The Ophelinius is, you can see in the Eastern Europe, the cholangiocarcinoma in Koreans and also in China. But in our area, the Great Mekong sub-region area, we have OV, so which means Thai, Laos, Cambodia, and also some part, especially the southern part of Vietnam, we do face the same, problem. And we also have the same behavior. We love eating, the freshwater fish. In raw, we have quite special menu that people frequently eat, and then they acquire the fruit infections. Actually, in Lao PDR, there is no record regarding to the incident of the CCA because of the lack of the registration system. But for sure, the OV prevalence is much higher when compared to the northeastern part of Thailand. So this is the report done by the Lao team to report the fruit infection rate in various, province in Lao PDR. You can see like in Savanakhet, 86%, in Salawan, about 60%. So this is the rates of OV infection in Lao PDR. And you can imagine how, big number of cholangiocarcinoma if they do it record. So actually the CCAL project, we implemented in 3 timelines. So we start in 2018 at Pak Ngum district in Vientiane capital. And then the project stopped for a while because of the pandemics. And then we started again the phase 2 in 2022, and then it's done in 2024. So we pick up 3 sites to work, including the Vientiane capital, the Savanakhet in the middle part of Laos, and Sampasak in the southern part of Laos. So we recruit the people, the 8 above certified in the project, and then 38 villages were enrolled in the program. And what we do is we register the risk people, we do the OV screening and treatment, we do ultrasound screenings, and when we get the suspected case, we do CT MRI confirmations, and we do also the training for HBP team for CCA treatments. And after that, we do HBP surgery for CCA patient that we found from the screenings. We do the follow-up, and also we do cholangiocarcinoma prevention curriculum in the pilot school as well. So this is the result. So you can see, different infection rates vary among the area. So in the Vientiane prefecture, the capital city, you can see only 5.6%, and then it's up high to 51% in the west, the middle part of Laos, and up to 78% of OV infection in the south. And for the ultrasound screenings, so we screen up to 3,000 people, and then we found about 67 suspected case, which need to be confirmed, which is account about 2.1%. Is it higher, about 2 times higher when compared to Thailand? Because in Thailand, we do the screening, we can see around 1% of, the suspected case. And we went there and then set up the surgeries in Mahosot Hospital in Vientiane capital. And then in this project, we have we able to do surgery for 11 cases. Some, after confirmation, they do not have cancer, and some of the patients, they are too advanced to be, operated, and also some, like let's say most of them refuse for the surgery. So we can do only 11 cases. And during the project, we can do the, trainings, and then now in Lao PDR, there are 4 HBP surgeons. So 2 in the Vientiane capital, 1 in Savanakhet, and 1 in Champasak. And now at Mahosot Hospital in Lao PDR, they could start hepatectomy, even in the very beginning state, and I'm sure that it's going to be improved by the time. And also we can train over 100 persons. I mean, the SPP treatment team, including the radiologist, the anesthetics doctor, and also the nurse. And we implemented the curriculum in 20 primary school, which is over 1,000, teachers and students were involved in the program. And I come to the conclusions. Basically, in Lao PDR, it is higher incidence of the OV infections, more than 50%, let's say. And then they also have higher suspected CCA case by using the ultrasound to screen, which can account for like 500 per 100,000 population in terms of incidence. And the challenge about during the projects, including the outbreak of the COVID, so that's why we need to stop a bit the program. And at the first period, when we do surgery, or even the ultrasound screening, we have to transfer the machine from Thailand across Mekong River to do work in Laos. And then for the future plan, we hope, especially the Lao government as well, they do hope to maintain the screening and the care activity. And then we still continue training program for the clinician and also the nurse team. And we also looking for more, chance to get the grant to expand the work in Lao PDR. Thank you so much.
Impressive, impressive. Not only that you do screening, you do prevention, you do treatment, and you do education. I mean, this is life-saving on a large scale we can dream of, I would say. Thank you so much.